Well, hello, Northside. It's a new year. It's full of new opportunities and new possibilities. God's at work through us and around us, exciting things we think are ahead. And we wanted to take a moment to address the question that is on everyone's mind right now. And that is, when are we going to be able to be back in the building together on Sunday mornings? We're all eager for things to get back to normal, but we're still dealing with the pandemic and we're likely to still be dealing with it for a few more months. So what's the plan? How will we know when it's safe to meet inside again? What's the data that we're going to use in making that decision? We're going to do our best in this video to answer those questions. But first, let's take a brief look back at the events of the past few months. As you know, beginning in March, we went virtual and we're meeting entirely online because of COVID. We made some initial steps to get back together. You remember we met and there was no singing. We had to wear masks and social distance and do all of that. And then the numbers of the pandemic shot up again and we had to go back virtual. And then we tried to come back again together. And when in September, when the positivity rates were lower and when the hospitals weren't overwhelmed and the cases were on decline, and we initiated a reentry plan. But sometimes in life, unexpected things happen and they force you to rethink and to change and to make a new plan.
In the early morning hours of October 19th, our head custodian, Amber Galway, came to work as usual. She walked into the atrium and discovered carpets soaking wet. She hurried into the worship center and she found water standing several inches high, pouring out from under the stage. One of the baptistry pipes had burst.
Amber called Felipe Flores, our head of maintenance. When he got here, he immediately got down on his hands and knees, went under the baptistry, and with a cell phone flashlight turned off the water. But the damage was already done. It would take weeks, ultimately months, to take care of everything. We removed the stage, moved furniture and equipment. We dried the floors and under the floors. We redid the walls in the worship center and in the restroom. We redid all the pipes under the baptistry, put new flooring in the worship center, in the entire first floor atrium, and in the fellowship room. Just this week, electrical work was still being completed.
An unexpected disaster. But it gave us a chance to rethink some things. After consulting with an acoustical engineer, we put in a high-quality vinyl plank on the floor of the worship center, which will greatly enhance our singing and allow us to use that room for banquets and other activities. We replaced the floor in the fellowship room with the same material, and since we were unable to match the carpet in the atrium, we replaced it with an upgrade in style and quality. As soon as we learned about the first floor flood, we began making plans to meet outside. And we soon discovered that meeting outside has some benefits. Not only is it safer, it has allowed us to sing together and see more people. And some of our high-risk members have been able to participate from the safety of their vehicles. An unexpected blessing, to be sure. But we knew that not everyone would be able to come to an outdoor service, and that the weather would be unpredictable. So we figured out a way to continue live streaming the service for those staying home.
And we pulled it together. We checked on one another. We called and we wrote each other. We reached out to those who had special needs. We are the community of Christ. We love one another, even when we don't agree. And not everyone has agreed. Some of us have wanted to be together more openly, and then others of us believe we have been way too open. But we are still the community of Christ. We remain committed to one another, no matter what.
We are eager to be together inside again. We all want to be there soon, but sometimes life intrudes, unexpected things happen, things force us to change, to rethink, to make a new plan. Oh my, this global pandemic has just wreaked havoc in our lives, in our city, in our church. It's made everything more difficult. We wanted to slow the spread in our community. We wanted to keep our members safe. We wanted to try to help keep our community safe. We wanted to protect our medical community. So we've had to stay distant, and we've worn masks when we've been together for the most part. We've worshiped at home. We've worshiped at the building, but we limited what we could do. After the first floor flood, we met outdoors. And all through that, we've still been dreaming and we've still been planning for the future. So what is the current state of the pandemic here in San Antonio, and what's our plan for reentry?
I was asked to give a little update of what I'm seeing regarding COVID nowadays, and I'll tell you that the numbers really suggest that we're about the same place we were in July. But remember, July was pretty bad. But I actually think we're worse. I think this is the worst we've ever been. The numbers look a little better because we're better at it. We're better at admitting patients only that absolutely require admission, and we're better at discharging patients faster. So that keeps the numbers of hospitalized patients down. We're also better at keeping people out of the ICU and keeping people off the ventilators. So the numbers are just as bad as they were in July, but they're a little bit deceiving in that I think the severity of this peak is worse than it's ever been. Now, there's a little hope that it seems like it's maybe flattening out and maybe things will be on a downtrend soon, but we're certainly not there yet. And I know it doesn't really feel like it's that bad when you're out and about in the community, but unfortunately, I think that's a false sense of security that people have because we've been dealing with this a long time, and we're just tired of it. We want it to go away. But I'll tell you, my colleagues and I are tired of it also. It is. I'm tired of admitting a patient to the hospital and knowing that there's a 10% chance that hug they gave their loved one when they left the car or when they dropped them off at the door, because there's no visitors for COVID patients, is the last hug they will have given that person in their life. I'm tired of discharging people without any means of helping them and knowing that they're going to be miserable for the next week or 2 weeks. We're all tired of it. The other thing that we're better at is some tools. There's some tools that are available now that allow us to predict things with a little better accuracy. And there's one particular tool that's available that suggests that in Bexar County right now, if a group of 50 people are gathered together, there's a 74% chance that one of those people will be infected with COVID and thus infectious and able to spread it to others. Now, distancing and mask certainly help reduce that significantly. But I've also noticed that we're kind of tired of doing that also. So this certainly is a bad time, but we're going to get through it. I think there is hope. We just need some more time before we can get this vaccine distributed, and it's going to work. It is going to work, and we just need some time to have it distributed, and that's unfortunately going to be many more months. Now, I've also been asked, like, when would it be safe to go back and meet in person? Well, I think part of that answer is that tool that suggests there's a 74% chance of someone being infected if there's a group of 50 gathered. But I also think we got to ask the right question, and I feel like many people are not asking the right question. And it's not that if I go, what are the chances that I get infected? But really, the question we should be asking is, if we go, if there's a group that gathers, what are the chances that I am going to infect 1, 2, 3, or 4 other persons in my church family? And that's a much harder question when it comes to risk tolerance, I think, or at least it should be a much harder question when it comes to risk tolerance.
Thank you, Bob. Dr. Frolickstein is one of several physicians who have helped Northside over these last several months try to make wise decisions. COVID is an insidious disease, and it is still spreading. We all have responsibilities, not just to protect ourselves and this congregation, but to help reduce the spread and to serve this community. That's one of the reasons why the elders formed a coronavirus response team several months ago The purpose of the team is to gather the best information we can from medical professionals, both in the city and in our congregation, to assess the needs of Northside and our city, and ultimately to advise the elders about the best decisions that can be made as we all try to navigate this global health crisis. We have been aware from the beginning that judgments will have to be made. Not all the decisions are clear-cut. We know that some will look at the decisions that have been made and think that elders and the response team have been too cautious, and others may think that these decisions have been too lenient. But no matter what, we know that the decisions that are being made have real life consequences. And that's why every decision has been bathed in prayer.
So what do we do next? The pandemic is worse in San Antonio now than it has ever been. But we, as your leaders, believe that the situation will begin improving throughout the spring, especially as more of our citizens and our Northside family begin to receive the vaccine, and the vaccine is effective against some of the mutation strains, and if we wear masks. We all want to begin moving back together and move toward normal as soon as is possible. We're currently meeting outdoors because outdoors is safer. We will continue to follow the CDC guidelines about masks and social distancing, and we will continue to live stream our services to those who want to worship at home. Once the COVID numbers in San Antonio improve, we can begin to move toward normal. We will do so in phases. We are focusing largely on 2 measures to help us to determine at what point we can move from one phase to the other. That is the positivity rate, how many people are getting sick in San Antonio, and what's called the city risk level, which is the stress and strain on the healthcare system of San Antonio and Bexar County. Right now, that positivity rate is around 17.5%. When the positivity rate in the city drops to 10% or less for 2 consecutive weeks, and the city risk level becomes moderate, we will go into phase 1. In phase 1, we will continue to have outdoor services as much as the weather permits. Again, being outdoors is safer. And some will want to sit in an outside service who would not feel comfortable sitting inside. For these reasons, in phase 1, we will meet outside whenever we can, but when the weather prevents us from meeting outside, we will move inside, always following social distancing and mask guidelines. As long as we keep our mask on, we will be able to sing. Also in phase 1, we will begin offering limited activities for children during the worship service hour, with guidelines based upon the advice of some of our medical officials and our current preschool guidelines. We will have to have a sufficient number of volunteers to staff these children activities. If any of the volunteers or the children test positive for COVID, we will have to suspend these activities until everyone is COVID-free. Please note that in the past, many of our volunteers are those who are most at risk right now, but we are trying to reach out to any new volunteers that we can to allow this to occur. When the city risk level is mild and the positivity rate drops to 8% for 2 consecutive weeks, we will move to phase 2. In phase 2, we will begin meeting indoors every Sunday morning, again with appropriate social distancing and mask guidelines. Also in phase 2, we plan to launch an adult Bible class meeting in our worship center, a youth group class in the youth room, and expand the length and scope of the children's activities, continuing to follow social distancing and mask guidelines. When the city risk level is low and the positivity rate drops to 6% or less for 2 weeks, we will move to phase 3. In phase 3, we will begin to increase the number of adult Bible classes, offerings, and begin offering age group specific children classes, continuing to follow social distancing and mask guidelines. When the positivity rate drops to 5% or less for 2 consecutive weeks, we will move to phase 4. In phase 4, we will resume as many of our normal programs and operations as possible, as long as they are consistent with the recommended guidelines. We will know more about that point as we get closer to that. We will continue to rely upon local medical recommendations and CDC guidelines. That will also include the number of our members who have been vaccinated. We look forward to that time and to a great celebration. Everything that I've just said has been posted. The details are in your church website, and we encourage you to go there.
The end is in sight. We are just a few months away from this being behind us. We're in the home stretch now. This is a time for patience and for courage. So let's look out for one another and listen to one another and pray for one another. We can do this. We can look to the future with faith and hope. If you have questions or suggestions about the reentry plan, we have scheduled a Zoom meeting for the congregation this coming Monday evening, January 25th at 7 o'clock. There will be physicians present. There will be members of the leadership team, elders and ministers who will be there. We'll provide instructions for how to register for that meeting. It will be recorded so that we'll be able to view it afterwards. But we want to make sure that you are informed and that you can ask all the questions that you want to ask. But in the meantime, this is what we know. God is at work. We are still God's people. And the future is in God's hands.
We want to encourage you. Northside, we want to encourage you to stay engaged. Join us on Sunday, either outside or online. We encourage you to check in with each other, the people that you know, see how they're doing. Love on them a little bit. Tell them you're thinking about them. Stay connected to your small group. If you're not in a small group, contact us, and we'll see if we can't get, we'd just love to get you connected. Let us know if you're willing to volunteer, because I'll tell you, when we begin reentry, we're really going to need some volunteers who are willing to help in that process. Let us know if we can pray for you, or if you need assistance in any way, and that includes financial assistance, food assistance, anything you need. We want to know about that. And we just want to thank you. We thank you for your generosity, and we thank you for your patience as we continue to love our neighbors. We thank you for being responsible and not fearful, and we thank you for being God's church. Stay strong, Northside. We'll get through all this together.